Welcome to today's webcast from the Agency for Healthcare Research and Quality about the SOPS Nursing Home Survey. My name is Kate Zebrak. I'm a Senior Study Director at WestAT, and I'll be the moderator for today's webcast. Before we begin, I have just a few standard housekeeping details. If you are having difficulty hearing the audio, try changing the audio selection so that Webex calls you back and connect through your phone rather than your computer speakers. If your computer freezes during the presentations, you can try logging out and logging back into the webcast to refresh the page, but you may just be experiencing a lag due to your internet connection speed. If you need help at any time during this webcast, use the Q&A icon that we will show you on the next slide. At any point throughout today's presentation, you might ask a question using the Q&A feature shown here. Depending on the browser you're using, your WebEx screen may look slightly different than the slide. Look for the Q&A icon at the bottom right-hand side of your screen and be sure that the drop-down option displays all panelists when you ask the question so that our team can see it. We encourage you to share your name and your organization or role when you type in your question. You can download slides from today's presentation at https://events.westat.com/SOPS, password SOPS 2022 with SOPS, SOPS in all caps. Today's session is being recorded. A replay of today's webcast will be made available on the AHRQ SOPS website. Now I'm happy to introduce our speakers for today's webcast. We're very pleased to welcome Karen Ginsberg, who directs the Agency for Healthcare Research and Quality's programs on the consumer assessment of healthcare providers and systems and surveys on patient safety culture. I'm also pleased to introduce Nick Castle, who is a professor and the chair of the Department of Health Policy, Management, and Leadership at West Virginia University. Finally, I'm happy to introduce my colleague, Teresa Famolero, who manages the SOPS databases and is also a WestAT Senior Study Director. And I'm Kate Zebrak, and I will be your moderator for today's webcast. Here's our agenda for today's call. We'll start with Karen Ginsberg giving a brief overview of the AHRQ SOPS program. Then Nick Castle will give background on the importance of safety culture in nursing homes. And Teresa Famolero will provide information on the SOPS Nursing Home Survey and accompanying database. We will end with a question and answer session. So let's begin, and I will hand it off to Karen.
Thanks, Kate, and welcome everybody to our presentation today on the Patient Safety Culture Program's Nursing Home Survey. Can I have the next slide, please? Before we start on today's program, I wanted to tell you a little bit about the Agency for Healthcare Research and Quality and what we do and why the SOPS program is important to our mission. So let me start off by telling you what AHRQ is. It's a research and science-based agency of the U.S. Department of Health and Human Services. We support evidence-based practices and importantly for this talk today, we are the lead federal agency that's charged with improving the safety and the quality of America's healthcare system. But what we're not is a regulatory agency. We cannot require that you use any of our tools and our products. We are a science-based agency. We don't have the authority to regulate the use of a tool or a program. On to the next slide, please. So AHRQ's mission is to improve the life of patients by helping healthcare systems and professionals deliver care that's of high quality and high value and care that's safe. And so to do this, we speak about our core competencies. We invest in research and evidence to make healthcare safer and improve quality. We create tools for healthcare professionals to use to improve care for their patients. And we generate measures and data that can track the performance of the U.S. healthcare system and evaluate its progress. And today's talk, you'll notice, cuts across all of these core competencies. The work on the surveys on patient safety culture addresses all these core competencies. And just a final note, we feel that it's important to push our science to implementation and get our tools and our products out to you, our users. So on the next slide, please. And let me just run down AHRQ's patient safety priorities: to focus on the areas of greatest impact, to extend patient safety improvements to all settings, to prevent healthcare-associated infections, reduce antibiotic resistance, build capacity in the healthcare system to accelerate safety improvements, improve communication and engagement between clinicians and patients, and make the safe thing the easy thing to do. So on the next slide, please. So we're in our 21st year. AHRQ has continuously funded the SOPS program. We're a program to advance the understanding and the measurement and the improvement of patient safety culture within healthcare settings. You know us for our surveys that are validated and use the best methods for development and testing. We conduct research to further our knowledge and measurement and improvement of patient safety culture. And we also support voluntary data submission to the SOPS databases. And I put a little asterisk there on this slide because I just want to point out that when you submit data to the SOPS databases, you are not submitting to the government. The government has no individually identifiable information on any of the SOPS data that's submitted to our databases. Westat, our contractor, maintains these data, protects the privacy and confidentiality of these data, and you'll be signing data use agreements that specify how the data will remain confidential and be used. So we're going to talk about that later, but I just wanted to make sure that when we start out, you're not submitting to the government. We can't access your private identifiable information. So on the next slide, please, let's just review the definition of what patient safety culture is. We define it as the beliefs and values and norms that are shared by healthcare providers and staff in an organization. And we say that patient safety culture determines the behaviors that are rewarded, supported, expected, and accepted within an organization as it relates to patient safety. And I just want to note that the culture can exist at different levels, from the unit or the department level within an organization to the organization itself, or to a healthcare system level. On the next slide. So the SOPS surveys are surveys of providers and staff about the extent to which their organizational culture supports patient safety. We refer to these surveys below that we've released as our core surveys. You can see that we've released 5 since the initial survey for hospitals in 2004. And then we have another version of the hospital survey up to version 2. Again, these are our core surveys. And then on the next slide, you can see that we've developed supplemental item sets that you can use to customize a survey, and they've been developed specifically for core surveys. So I'd like to point out, for example, that for the hospital survey, we recently released a workplace safety supplemental item set that's developed specifically for use with the hospital survey. And I want to point out, we're going to talk about this a lot today. We are in the process of developing a workplace safety item set for the nursing home survey. So you'll hear more about that later. On the next slide, please. So I just want to go over the recent history of what's happened to the nursing home data submission and database. So we try to maintain a 2-year cycle of opening the database for data submission for all of our surveys. And the last time we turned out a database report was in 2019 for surveys completed between 2016 and 2018. Just as a reminder, 191 nursing homes submitted data, and with top scoring composite measures being overall perceptions of resident safety and feedback about communication about incidents, feedback and communication about incidents. And we were ready to go with opening the database in 2020 for more data, and we developed a whole program to encourage you and invite you to conduct the survey and submit data. And then the pandemic happened, the COVID-19 pandemic, and we just had to postpone data submission and our activities. So this is the first time we've opened the database since that 2019 report. And on the last slide, my last slide, I just want to spend a little bit of time talking about why you should participate and why we hope you do. First of all, this information we hope is going to be very useful for you for quality improvement. The surveys will help demonstrate your strengths, your organizational cultural strengths in promoting a safe patient environment, and also for identifying areas for improvement. And you can use that information for your internal quality improvement purposes. Data submission, as I said, is voluntary, it's confidential. You'll receive excellent technical assistance from Westat to help you get started. And you can also announce to your community that you're participating voluntarily in a program sponsored by the agency that has the lead for, in Health and Human Services, is the lead for quality improvement and patient safety. So, and I think it's important to announce that you participate in these kinds of efforts. So we hope you'll participate. We hope you'll use the survey, submit data. We don't doubt the usefulness of the information, but we realize that you have significant logistical concerns about adding another activity to the nursing home workload. And so we hope that that said, we still hope this information is going to be useful to you, that you will be able to participate. And I just want to leave you with a thought before I turn this to Nick. That one nursing home administrator said to me about the nursing home SOPS survey. She said, "We cannot afford not to do this survey." And that stuck with me. I hope it's resonating with you. So thanks again for joining us. And Nick, the floor is yours.
Well, thank you very much. It's actually a real pleasure to be here today speaking to you. I'm Nick Castle. As a way of a very brief introduction, I've been examining quality in nursing homes for about 30 years now. I've examined things like turnover, satisfaction, leadership, and why I think I'm invited here to talk today is I've also examined patient safety. But what I've tried to do in most of my work, or all of my work, is to try and make a positive impact on the quality and safety of nursing homes. And again, that's why I think I'm invited to speak today. I think that the survey on patient safety culture in nursing homes is and can be a useful tool to help and make a positive impact. So with that, I wanted to get to my first slide. And here we go. Go figure. You've got a professor talking about patient safety, and he puts up 2 reports that are more than 20 years old now. And yes, for anyone does the chat box, I do recommend that you read them. But all kidding aside, these are 2 fundamental reports that have influenced why we are where we are today with respect to safety culture and quality in healthcare. And the reports were groundbreaking. And one of the bottom line conclusions was that there's somewhere between 44,000 and 98,000 people in the United States that die each year as a result of medical mistakes. So next slide, please. And to put that in context, that's somewhere between the 3rd and the 5th leading cause of death in the year 2000. So yes, I am missing 3, 4, and 5. That's because it depends on which statistic you use. When we say between 44,000 and 98,000 folks die each year, that's often put as about approximate of 100,000 per year. You often see that as a figure. But the issue there is when these reports were done, institutions such as nursing homes were not included. So my best guess would be that if we did this now, or these reports had included nursing homes, that we would say that medical mistakes are the 3rd leading cause of death in the United States. So next slide, please. So with that, what emerged is patient safety culture as a top priority for many healthcare settings. And I would say it is fair to say that it also has emerged as a top priority for several, if not many, nursing homes. I know many of you on this call pay a lot of attention to falls, medication errors, use of restraints, which have almost disappeared now in the United States. But I'd also say that it is fair to say that some nursing homes do lag behind in this area. And we can fast forward to 2022, and if you look at two very recent reports, there's a presidential agenda for nursing home reform, and there's a National Academies report that details, let's just say, issues with nursing homes. And I would say that these are less than complimentary. They detail poor quality, errors in many different areas. And I would need to emphasize here, this isn't all nursing homes. This is just something that we seem to go through a lot in the nursing home industry, that negative reports come out and there's negative press, and it isn't a condemnation of all nursing homes, but we have to acknowledge that sometimes there are issues that develop. So I don't want to leave this as, boy, we've got the presidential agenda and we've got the National Academies reports this year that are not so great. There are other reports that you can go to that are actually a little bit more helpful, let's say. So if you want, you've probably seen the presidential agenda and national academies. You might not have seen the IHI National Action Plan. What this actually does is, I'm reading directly from their page here. It says it gives knowledge and insight into actionable steps that can be taken. So rather than list off problems and issues, this actually gives steps and tips that could help any nursing home improve their quality and patient safety. And just as an FYI, two of the top actionable items that they include are leadership and culture, which is something you're going to see on several slides that come up next. And I will say, before I go to the next slide, I do often get questions here. Someone would say in the chat box, Nick, we're not hospitals. We do things differently. Nick, you know, a lot of these reports don't apply to us. And I would push back and say, I think you should look at the IHI National Action Plan, and I would bet that every single item that they recommend does apply to nursing homes. And the other thing that someone might say is, well, we don't have time for this. And I agree. At this point, I've been to more than 500 facilities. I've worked with many owners and administrators, and your work is different from hospitals, and your scope of work is certainly more extensive than most folks that I've seen in hospitals. But I wouldn't say that was an argument not to use something like this tool. If this tool helps you have one less family member call you every single day with a complaint, if it gets an ombudsman complaint one less per week or per year or per month, if you get one less inspection by the state surveyors, if you have one less lawsuit because somebody had fallen and broken a hip, then I would say that the time put into this tool is probably going to pay dividends. Next slide, please. So with that, as I mentioned earlier, culture does come up a lot. And not only does it come up a lot, this is one of my favorite expressions here, that the most fundamental barrier to improving the safety of patient care, the culture. And so I would say that this is an argument to use the nursing home survey on patient safety culture. It will give you information on your staff perceptions of your patient safety culture, and even give you options and areas that you may have strengths and weaknesses to want to improve. Next, please. So as you use the survey on patient safety culture, or as you look into patient safety culture, you'll see a few high-level things that come up. And this is sort of fundamental to safety culture, and I also think to quality improvement in general, that it's the processes of care that probably, or not just probably, that should be looked at and changed. And the expression you see here is, it's the processes, not the people. And what we mean by that is, if something goes wrong, invariably it is probably somebody that will be blamed, or somebody had something go wrong while they were using a piece of equipment or while they were taking care to a resident. But invariably, they were using a process. So what this has developed into is something called systems thinking. And I can't do justice to systems thinking in a 1-minute slide. But essentially what systems thinking is yes, we all interact in the nursing home setting or the healthcare setting in general. People interact with people, workers interact with workers, but we're doing so in an interlocking series of processes and policies. And it's these that invariably go wrong. It's not the people that invariably go wrong. And something that you often hear around this is staff come to work to do a good job. Or you could flip that and say, nobody comes to work to hurt somebody, or no one comes to work to kill somebody. And I would say that if you don't believe that staff come to work to do a good job, then you have quite a big problem with your hiring processes and your processes in general. I would say that pretty much everybody comes to work to do a good job. But what happens when something happens? So let's take an example here. You've got a resident that rings the call bell on the night shift, and the aide is slow in getting to the resident. Well, the resident gets out of bed and falls, and the fall leads to a broken hip, and the resident has to be transferred to the hospital. And we know the scenario that's coming up here, so I don't need to go any further. But the other end of the scenario here is it's the aide's fault. So the aide didn't get there in time. And we've all been to places and we've all seen aides be blamed for the resident falling. Well, you could peel back the onion here. What if the aide was in a room helping another resident? What if there wasn't a second person to cover for that aide to help the resident that called the call bell? And again, we can go down this track again, and we know this is probably what happened. The aide, more than likely, wasn't sat thinking, I am not going to help that resident, and she did not come to work to harm somebody. But what do we do? Well, we blame the nurse aide. We scream at the nurse aide. We fire the nurse aide. But do you think that she then wants to work with the guilt of harming someone? I very much doubt it. So you get where I'm going with systems thinking and processes of care. That these are the kinds of things that we look at in quality and patient safety culture. So next, please. And this is where, again, on a sidebar, someone would say, well, yes, Nick, we have we agree. We've looked at all of our processes and we pay a lot of attention to our processes, and this won't happen to us. And this is why I love this Swiss cheese model that was developed by James Reason. And what he says is, yes, you can have great processes, well-developed processes. Let's say they work 99% of the time, and 1% of the time they don't. But then the one process leads to the next process that works 99% of the time. And then that leads to the next one. And as you'll see here, you've got multiple processes that are put together. But what he says is, what if one fails 1% of the time, and the next fails 1% of the time, and the next fails 1% of the time? Well, these 1% failures can actually align such that an accident can actually occur. And so let's go back with the falls example. What if, I bet most of you listening to this have something like a falling star program. So we'll go with falls again. But you've got a new director that is looking at your Falling Star program and interprets some information on the MDS differently from that in the past or how you would like it to be done. So some of the documentation isn't so great for the Falling Star program, and the resident isn't put on the Falling Star program. So the resident is then placed in a room that's further away from the nurse's station than you would normally like for somebody that you think that might be at risk of falls. And then in the night staff, you have an agency nurse that has come in and doesn't know the rooms very well, doesn't know the residents very well, and you get where I'm going. That these errors or these small mistakes line up and the resident falls. And to be honest, I've used a 1% figure there. Reason actually said 99.9%, and it still works. No matter when you have something like falls, when you have 50,000 residents in a facility a year, that includes the rehab residents, etc. You've got high numbers of opportunities for mistakes, even with the best of processes. So that's how and why we continue to look at processes and reevaluate processes. So next slide, please. So with that as a background, we do have some evidence that we can do a little better with respect to patient safety in nursing homes. So we a while back did a study on asking questions that were similar to some of the patient safety questions that you'll see in the nursing home SOPS. And one of the questions was, we have a patient safety problem in this facility, and with the way the metric is here, the closer to 100 you are, the better. You'll see that nursing homes did not fare very well compared to hospitals. So some evidence that maybe the nursing home survey on patient safety culture could be useful in nursing homes. Maybe there's some evidence that staff themselves think there's some safety problems in facilities. And again, I know that many facilities have made great inroads into things like moving and transferring, medication errors, falls, pressure ulcers, and sanitation. But I would say that if we were to be honest, there still are issues in each of these areas. I'd say that sanitation is particularly current given COVID, but it was particularly relevant to nursing homes before COVID, when you have things like methicillin-resistant Staph aureus or norovirus that can close a facility down. We've been into facilities where sanitation, i.e., let's say hand washing, with a norovirus outbreak, and you still only have 30% compliance with hand washing. So I'd say, what's up? Maybe there's something up with the culture that could have been changed in those facilities. So next, please. So I've sort of emphasized that what this can mean for residents and safety for residents, but the patient safety culture really does impact staff too. I know probably most folks on this call know this already, but the injury rate for nurse aides is second among all industries or major industries in the US. And a lot of this is back issues when they're trying to lift residents without either the adequate equipment or adequate help. And again, this is just one line on the slide, and I know we could have a lot of chat back and forth, and there's Hoyer lifts available, there were staff available. So why does the nurse aide try to lift a resident by themselves? Well, safety culture maybe, or maybe something else with staffing, or whatever it would be. But the bottom line is they still hurt their backs and they still have injuries. So that, which can lead to call-offs, it can ultimately lead to sometimes that they can't work anymore. It could lead to lawsuits, etc. So the patient safety culture doesn't just affect residents, it does affect staff. And as I've got on one of my subsequent slides here, I think now of all times, we are coming to appreciate staff and what staff do. So this tool could help with staff satisfaction, staff turnover, etc. So patient safety may be another problem with the image of nursing homes. We may see it come forward as a major problem with some of these agendas that are out there now. So maybe getting a handle on safety in nursing homes with using tools like the Nursing Home Survey on Patient Safety Culture may be useful and may get the nursing home industry a little bit ahead of the curve on this. Next slide, please. And some of the bottom lines on this are patient safety is not just about telling people to be more careful. It is a cultural thing. It is how you behave in many different ways, respect to quality and culture. And when I list this one out in my mind, I have a picture of a cartoon where somebody is saying, someone's up a ladder and someone's at the bottom saying, "Don't fall." Of course, nobody wants to fall off a ladder. And again, we're getting back to nobody wants to hurt somebody in a nursing home. No one wants to have the issues that we sometimes see in nursing homes. But some of these things happen. And so how? Well, maybe it's partly to do with the culture. And again, improving patient safety culture is trying to move from blame and punishment to something that is more just, which would be, again, not blaming a CNA or an RN or a unit clerk for errors, but looking into why the errors occurred, and going deeper into the issues and the processes. So with that, I do advocate for the use of the survey of patient safety culture in nursing homes. I don't see a downside. I don't see a negative side. I think for improving quality and improving safety, it is a tool that may give you some valuable information. And I think as we started, this isn't something that gets passed on to regulatory agencies. It's something that is internal for you to use. And what I've seen in the past is I think tools like this can save you time, they can save you money, they can give you more satisfaction, and they can give your staff more satisfaction. So with that, I do appreciate the opportunity to talk to you. Thank you.
So thanks so much, Nick, and Karen as well. Very, very good presentations. Again, my name is Teresa Familero, and I will be speaking with you today about the SOPS Nursing Home Survey and the accompanying database. Next slide, please. So let's start with, first of all, how to get the SOPS Nursing Home Survey and the toolkit materials, as well as what we're talking about here is the Survey User's Guide. So on the AHRQ SOPS website at www.ahrq.gov/SOPS, you will find the survey user's guide, and some other toolkit materials. And you can just simply click on SOPS surveys at the top of the page, and then go to the nursing home link, which has all of these materials. So of special importance here is what we're talking about is the Survey User's Guide. And really the Survey User's Guide is going to help you to administer the survey. It's going to provide you with all of the to-dos, schedules, and things like that. So the User's Guide I would say, in a nutshell, really discusses the issues and the major decisions involved in conducting a survey and reporting the results. It includes information on getting started, selecting a sample, determining data collection methods, and establishing your data collection procedures. There's even a special chapter on doing a web survey if you prefer to do that over a paper survey. And then, of course, how to prepare and analyze your data and produce your results and reporting. Next slide, please. So one thing too about using the survey or your data collection part, the survey can be administered by paper or by web to your staff and provider respondents. Paper generally yields a slightly higher response rate, but takes a little bit more time and upfront resources. So you have to print out the paper surveys, you have to make sure they get to the right people, etc. Administering the survey by web is fairly easy, and the user's guide provides information on how to set that up. So as you can see, in the 2019 SOPS nursing home average response rates, we have paper at 60% and web slightly lower at 55%. So the other thing is that you can administer the survey yourself. The user's guide shows you how to do that, and we do have free technical assistance to help you with that as well. But you can also hire a vendor to administer the survey. So if you do prefer to have a vendor conduct your survey administration, the SOPS Technical Assistance Help Desk can provide a list of vendors that have administered SOPS surveys and submitted to at least one of the SOPS databases. So you may want to check that out. And if you're administering the survey to multiple nursing homes, please ensure that each nursing home has an identifying number so that the responses can be linked to a specific site. And this is really, really important. So if you're doing a web, just make sure that somehow you're able to identify that who the respondents are from a single site as well as from paper. Next slide, please. So who should take the survey? Well, this survey is really designed to be administered to all staff as appropriate. So that means physicians, other providers, nurses, CNAs, PRN staff, management, administrative staff, clerical, business staff. And so really just all staff. We think that patient safety is everyone's responsibility. And so in order to get a good picture of it, you should administer the survey to all staff. The staff should have knowledge of data activities in nursing homes and regularly interact with staff in the nursing home. So I would say that's super important. They can, they should speak English or Spanish because we do have the survey available in both languages. Next slide, please. There may be some challenges. You may find some survey administration challenges. I have your fear of computers on the slide, but really it's just more, I would say, being comfortable with computers. If your respondents in general are not very comfortable with computers, then just administer the survey by paper. It's one thing that I always say to people when they want to administer the survey by paper is do it during a meeting so that everybody does it together. It gets done, it's put into a confidential area, and people feel safe doing it. If English is their second language and they speak Spanish, we can provide a Spanish version of the survey, so you can find that on the AHRQ website. Or you can have someone who is, I would say, in a non-supervisory role, read the survey item to them in their own language, and then enter their responses. Also, too, another challenge may be that people are so busy in nursing homes, right? There's so much going on. Well, make it easy for staff to complete the survey. Like I said before, pass out the survey during a meeting. Make it super, super easy. Next slide, please. So here's an example of a survey timeline. The survey timeline is also in the user's guide. So this is just to give you an example of what you can do. So of course, in the pre-planning phase, we want you to determine resources and the scope, establish a point of contact, decide whether you're going to use an outside vendor, and then of course, prepare your survey materials and then promote the survey. And then by week 3, you're sending that first invitation, you're sending out reminders, weekly reminders, and then in the final week, you're closing out your data collection. Next slide, please. Okay. So let's imagine we just finished data collection. The next step in the process is calculating and presenting your results. So let's go to the next slide, please. So we have made a very nice tool called the SOPS Nursing Home Data Entry and Analysis Tool. And the tool makes it very easy to enter your respondent data, and it automatically calculates your results with the SOPS Nursing Home database results. So the tool uses Microsoft Excel, so you can enter the survey data to create tables and graphs, and you can also export your survey data so that it can be administered to the SOPS Nursing Home database. So it's really, really simple. It is the only tool that's not available on the AHRQ website. However, you can request this tool by contacting our help desk, which I will provide to you towards the end of this presentation. Next slide, please. So here's an example of the types of results you can get from the Excel tool. In this example, you see some of the composite measures compared to other nursing homes that participated in the 2019 nursing home database. And like I said, if you don't want to use the Excel tool, this is an example of the Excel tool. If you don't want to use the Excel tool, you can also refer to the Survey User's Guide for how to calculate and report your results. Next slide, please. So now we're going to talk about how you can use your SOPS nursing home survey results for improvement purposes. Let's say you just saw all your results in the Excel tool, or you calculated your own results. Now, what are we going to do with those results? Let's go to the next slide, please. So once you've reviewed your results, it's really, really, really important that you share your results throughout your organization. So you want to start with your leadership, then go to your department managers, and of course, your frontline clinicians and staff. Everyone will appreciate seeing the results, and it will let them know that their survey responses are important. And sharing the results with leadership will also help to increase buy-in for the patient safety improvement process that I'm going to talk about next. Next slide, please. So after you've administered the survey and analyzed your SOPS results, we do have an action planning tool to assist you in developing an action plan based on your SOPS results to improve patient safety culture in your nursing home. The action planning tool that we do have on the AHRQ website is designed for all survey settings and provides step-by-step guidance to help survey users develop an action plan to improve patient safety culture. So the tool includes an action planning template your organization can use to identify your patient safety culture areas for improvement. Also shows you how to document your goals and initiatives, needed resources, process and outcome measures, and of course, timelines. Next slide, please. And so as you're working on your action plans and identifying areas of improvement, you might be interested in checking out another resource, which is the Improving Patient Safety Resource List for users of the AHRQ Nursing Home Survey on Patient Safety Culture. So the document contains links to practical resources that are free and publicly available to improve patient safety culture and patient safety. And what's really, really exciting is, let's say you have a specific composite measure that you want to work on. There are specific resources available by composite measure. So here I'm showing you the composite measure overall perceptions of resident safety, and underneath you see some tools that can specifically help to improve that patient safety culture composite measure. Next slide, please. So now another exciting thing, the SOPS nursing home database. Let's go to the next slide, please. So what is the nursing home database and what are the goals of it? Well, basically, I would say it's a place where all SOPS survey data can be submitted to, and it's also a place where we do analysis and develop results from a large number of nursing homes. So you're not in your own nursing home world, you're actually able to see results from a larger number of nursing homes. We present the results by facility characteristics. So if you want, let's say you're a smaller nursing home or a larger nursing home or by your ownership, you'll be able to see your results by bed size and ownership. And then respondent characteristics such as job title. I think we also do tenure within the nursing home. So that's really, really exciting and a way for you to drill down in your results. And see how other nursing homes are doing in comparison. Super important for the database is that we allow nursing homes to identify strengths and opportunities to improve patient safety culture. So if you see, oh my goodness, like this specific composite measure is really an area of strength for all nursing homes, I bet you we're all experiencing this problem. Wouldn't it be great, if we can somehow work on this area together, possibly. Next slide, please. So here are some, the 2019 SOPS Nursing Home Database Composite Measure results. I think it was Karen that mentioned that the last nursing home database is a 2019 one, and that's mostly it was due to COVID. But here are some of the results from that database. And here I'm going to show you the most positive composite measure results. So just so you know what a composite measure is, it's basically an area of patient safety culture in nursing homes that is made up of 3 to 4 survey items. And so for the 2019 database, we see that overall perceptions of resident safety and feedback and communication about incidents are the highest scoring composite measures on average with 85% positive response. Next slide, please. So here are the middle scoring composite measures. And as you can see, the scores are very similar with training and skills at 69% positive and compliance with procedures at 65% positive. Next slide, please. And here are the rest of the composite measures, the lower scoring ones. And you can see staffing is the lowest scoring composite measure at 46% positive. And that's quite a bit lower than the other ones. So it's something to note. Next slide, please. So you might ask yourself, okay, I'm administering the survey, but why should I participate in the SOPS nursing home database? Well, there are some benefits and some very exciting ones. First of all, we produce database reports and infographics that display aggregated results from all participating sites. And as a participating nursing home, you would be part of that. And so you would see in the nursing home database report percentile distribution. And you would see exactly where you would be able to score or where you would fall within that distribution based on your own individual results. Secondly, and this is super important, each of your participating nursing homes would receive a customized feedback report. And so this displays your nursing home site results compared to the database results. And it really helps for you to identify strengths and areas for patient safety culture improvement within your nursing home and then, of course, across nursing homes. Let's go to the next slide, please. So here's an example of a SOPS nursing home infographic that is on the AHRQ SOPS website and in the 2019 SOPS nursing home database report. This is pretty exciting, and you can basically bring this to board meetings and show your leadership, what they're contributing to and how they may compare to other nursing homes. Next slide, please. And as I mentioned, participating nursing homes in the SOPS nursing home database do receive a free feedback report comparing their results to other participating nursing homes. So here's an example of some graphs that are part of that report. And you can see your facility is on top and the database would be on the bottom in the light green. Next slide, please. So the nursing homes survey results are also related to some of the CMS Nursing Home Compare 5-star ratings. And I think this is super important to bring to your leadership and let them know that we have found that higher patient safety culture scores are associated with better quality ratings. So we do know that some of many of the nursing home SOPS measures were related to the overall health inspections and quality 5-star ratings. So just wanted to point that out. So next slide, please. And now this is super exciting, and I just wanted to point this out to you. I just want to bring this really to your attention. There is the SOPS Nursing Home Workplace Safety Pilot Test. I'm going to go through this quickly because we're running out of time, but we will be administering a free pilot test of the nursing home survey on patient safety culture, which is the core survey, with the pilot safety supplemental items in summer 2022. Participating nursing homes will receive a feedback report comparing their results against other pilot nursing homes. And if you're interested, contact workplacesafety@westat.com. So we absolutely encourage you to do that. And then when you can submit, next slide, please. And if you're going to submit to the nursing home database, that is going to be open September 1 through September 21, 2022. And we will also include the pilot data into the database as well. So as long as they sign a data use agreement. Next slide, please. Who is eligible? This would be eligible for the nursing home database and for the pilot. It would be, you'd have to have a healthcare facility or contained area of a facility with licensed nursing home beds. We do not accept assisted living, community care, or independent living facilities. Next slide, please. And then just some requirements for participation. You just have to administer the SOPS survey in its entirety without modifications or deletions. As I said before, must be in the U.S. or U.S. territories, sign a data use agreement, complete data collection before the end of the submission period, submit files per specifications, and upload your survey data through a secure online data submission system. Next slide, please. Before we jump into the Q&A portion of the webcast, I just wanted to share with you our information on technical assistance and how to stay in the loop on SOPS updates. So we offer free technical assistance, or TA, to the SOPS surveys. Our general TA help desk can be reached at 1-888-324-9749 or via email at safetyculturesurveys@westat.com. And then our databases TA mailbox or help desk can be reached at 1-888-324-9790 or databases on safetyculture@westat.com. And so we're happy to help you with anything. And then we do send email announcements through our SOPS email updates, notifying users about various SOPS products such as Webcast, data submission, timelines, and other products. You can sign up for these email updates by going to the top right corner of the AHRQ website and choosing the email updates associated with the surveys on patient safety culture. So now I'll turn it over to Kate to facilitate the Q&A session. Thank you.
Great. Thank you, Karen, Nick, and Teresa, for your informative presentations. You've shared a lot of helpful information about the SOPS nursing home survey. So just as a reminder to our participants, you may ask a question through the Q&A feature shown here. Just look for the Q&A icon at the bottom right-hand side of your screen and be sure that the drop-down option displays all panelists when you ask your question so our team can see it. And we encourage you to share your name and your organization or role when you type your question. Again, you can download slides from today's presentation at https://events.westat.com/SOPS, password SOPS 2022 with SOPS in all caps. And if you joined late, a replay of today's webcast will be made available on the AHRQ SOPS website. So we are going to leave up that instruction for you and go to our Q&A. And I'm just going to scroll over to that section to see what we have here. And while we are waiting for you to submit your questions, we do have some that we received during the registration, so we'll start with those. One question is, where can we find the slides from today's meeting? So to download the slides, go to events.westat.com/SOPS and use the password SOPS 2022 in all caps. This next question we have here is for Teresa. My nursing home is interested in participating in the free pilot study of the nursing home survey and workplace safety items. How much time does the nursing home have to spend on the pilot study, and what do nursing homes have to do to participate in the pilot study? Teresa?
I'm so sorry. I was just unmuted myself. So I'm so glad you asked that question. So since Westat is conducting the survey administration for free, very little time will be asked of nursing homes, the nursing home points of contact. So nursing homes have very little to do for the pilot. We'll just ask the points of contact to submit their staff list and a letter of support. We have a letter of support template, so it's just a matter of putting in your contact information and putting it on your letterhead. and we'll ask you to promote the survey, but we also have a flyer for you to do that as well. So it's just a matter of putting that in your break rooms and on your bulletin boards. And regarding the types of nursing homes needed for the pilot, we will need a broad spectrum of nursing homes, and we'll do everything we can to fit your nursing home in. So just wanted to point that out.
Great, thank you, Teresa. This next question is from Nancy Connolly, and it's also for you, Teresa. So following on Dr. Castle's statement about time and to encourage participation, do you have any estimates for the time commitment for individuals completing the survey and for those responsible for oversight and communication with AHRQ?
Yeah, so as far as the actual respondents taking the survey, if they are just taking the core survey, that is about 10 minutes to take the core survey. If you participate in the pilot survey, it will be about 20 minutes to complete the survey. So that's why I sort of recommended maybe doing it during a meeting or something like that so that everyone is taking the survey. As far as oversight and communication, I think you said with AHRQ, it's really with WestStat supporting AHRQ. I would say that once you have completed the survey and you've collected your data, if you're doing it, you will have to have some time to put that data into the specifications for the database. It should not take that much time. If you use the Excel tool, that actually exports the data directly into the format we need for the database. So that's a very small amount of time. And then as far as submitting to the actual database, let's say filling out the data use agreement and registration, I think that whole process is, it shouldn't take that long. We're talking less than an hour to do that. But we do offer free technical assistance, and we can walk you through the process and get it done for you. So it's very little time. Now, if you participate in the pilot, there's very little time asked of you because we are doing all the survey administration. So all you have to do is give us that staff list and letter of support and just, promote the survey by putting the flyer on bulletin boards and lunchrooms, etc. So we try to make it as easy as possible for nursing homes.
Right, thank you. And this next question is from Patricia Leonard. I'll direct this one to you, Teresa, as well. Sounds like there is a charge for this survey. How much is it?
There's absolutely no charge for this survey. This survey is 100% free. It is completely available on the AHRQ website. Participation in the pilot test is also free of charge. We do the actual survey administration for you for free. We have free technical assistance to help you in any way possible if you're doing the survey yourself. And submitting to the database is 100% free. So there is absolutely no charge. And when you participate in the database, you get a free feedback report comparing your results to other participating nursing homes.
All right. This next question is for Karen from Farheen Rao, asking, does AHRQ plan on eventually taking the pilot study internationally or staying in US only?
Hi, thanks for that question. I'm not sure if the question pertains to the pilot study or the survey or the program, but I just want to say there is a large international use of these surveys. It's called the HSPSC internationally. So there already is in many countries around the world significant international use. We have lists of individuals who have administered the surveys and have translated them. That said, I just want to point out that the survey is only, the measures on the survey are only valid for the US and the US healthcare system. And in English or Spanish are formal translations. So if you're interested in using it abroad, you're welcome to do so. Please note that the psychometric characteristics of the survey may not hold internationally. You're welcome to translate it. If you want to do that, please drop us a note to ask formal permission. That's just part of some legal work we have to do, but there's no reason why you wouldn't be able to use this survey internationally or translate it. We aren't conducting the pilot study abroad. We're only conducting it in the US, where we are confident that of the psychometric characteristics of the survey in this healthcare system. Thanks.
Excellent. Thank you, Karen. Looks like we might have time for just one more question. This one is from Natalia Chalmers. Are there oral health questions on the survey? Teresa, would you be able to answer that one?
Okay, sure. I just want to make sure. Yes. So there are no oral health questions on the survey. This survey is really designed specifically for nursing home staff and providers, and it really asks for their opinions about the culture of patient safety and healthcare quality in their nursing home. It doesn't get into specific health outcome or health related, I would say physical health related questions.
All right. And it looks like we are at the end of our time today. So I'm sorry if we didn't get to all of your questions, but we did get to a fair number of them. So thank you so much for your questions. And if you want to follow up with further questions, feel free to email our technical assistance line. That's safetyculturesurveys@westside.com. A brief webcast evaluation will pop up when you close out of today's webcast. So please take a moment to provide us with your feedback, as it helps us to improve our offerings and plan future events that best meet your needs. We invite you to visit the AHRQ SOPS website and contact us at any time by email or phone. Thanks again for joining us. This concludes today's presentation.